brain fog, lost words. Why did I walk into this room? If you're dealing with that around menopause, you've probably wondered if HRT could fix it or even prevent dementia. Today, I'm breaking down exactly what HRT does and doesn't do for your brain. I work with women every day who want clear, honest guidance, no scare tactics, and no hype. By the end of this video, you'll know what HRT or hormone replacement therapy, when it makes sense for cognitive symptoms, when it doesn't, and what actually protects your brain long term. First of all, HRT or hormone replacement therapy replaces estrogen, and if you have a uterus, adds a progestin or progesterone. It's prescribed to treat hot flashes, night sweats, sleep disruption, mood changes, and vaginal symptoms. It is not designed as a memory drug. Let's chat about why brain fog happens in perimenopause and menopause and what this means. So, during the perimenopause transition, hormones fluctuate and drop. Sleep gets wrecked by night sweats, and mood can shift. Hello, anxiety or low mood. Poor sleep and a stressed nervous system equals fuzzier memory and slower word finding. So, when we treat symptoms of your hot flashes and night sweats, oftentimes thinking feels clearer. But here's what the research shows. Short term, in women near menopause, hormone replacement therapy generally doesn't harm or boost cognitive test scores. Some small studies show tiny bumps in verbal or working memory, but this is actually inconsistent. We also know that starting hormone replacement therapy late, over the age of 65 plus, is different. In older women, combining estrogen and progesterone over the age of 65 actually has increased the risk of dementia in trials. Estrogen only, when we took away the progesterone, didn't change this either. So, HRT isn't a proven dementia prevention tool. Timing matters. Using it for symptom relief earlier in the transition is usually cognitively neutral, meaning it doesn't really help, but it certainly doesn't harm. Starting later for a brain benefit is not advised. If hot flashes and insomnia are crushing you, treating them can improve your daytime focus. If you've had your ovaries removed young or you stop cycling early, replacing hormones to the typical age of menopause supports overall health, which includes brain health. So here's what you need to know about HRT. Estrogen only versus combined with progesterone. Your uterus decides that, not your brain. If you have a uterus, you need progesterone to protect against that unopposed estrogen. Unopposed estrogen increases the risk of things like endometrial cancer. When we look at pills versus patches versus gels, we usually choose this based on clot risk, preference, and overall health because there is no strong cognitive winner. When we look at progesterone, micronized progesterone is often better tolerated for sleep, but there's no cognitive superiority. So with your healthcare provider, it's important to just choose the one that works best for your lifestyle and your current symptoms. And who should not use HRT for brain health? If your only goal is preventing dementia, HRT is not the tool. If you are well past the ages of 60 to 65 and considering starting, talk to your clinician because oftentimes risks will outweigh the benefits. So, what actually does help brain health? First is sleep, about 7 to 9 hours. Treat your night sweats first, which actually might require HRT and or other tools. 2 is cardio and resistance training. This is because circulation plus better insulin control equals better brain health and brain protection. Next, treat your metabolic health. This means blood pressure, A1C, insulin, cholesterol. Think of treating your brain health as diabetes prevention as well. And when we look at dietary pattern, we know that a Mediterranean diet with fiber and colorful plants and omega-3s is best for brain health. Also, managing stress, breath work, walking, sunlight, creating boundaries, and saying no, which in my population and the women I work with tends to be a difficult task. And here's the top 5 questions about to speak to your clinician about. 1, what are my top symptoms that we're treating right now? 2, am I within my 10 years of my final period or under the age of 60? 3, what's my personal risk profile? Clots, stroke, breast cancer, migraines. 4, which formulation fits my risks and my preferences? Should we go with a patch, a pill, a gel? And what is our exit plan and how will we monitor my benefits and risk? And also, here's some mini rapid fire questions to get your questions answered and things that I'm often asked. Number one, will HRT make me smarter? No. It can make you feel clearer if it fixes sleep and your hot flashes. Will HRT prevent Alzheimer's? This is not proven, as we've discussed. Is late life HRT risky for cognition? Yes, especially when it's combined with estrogen and progesterone. And like I said, we cannot just give you estrogen alone if you have a uterus. Can I try HRT for my brutal night sweats? Yes, that's exactly what it's for. Discuss the timing and risks with your healthcare provider. If you want a practical plan to clear brain fog, sleep, metabolic health, and get symptom relief, these are your best levers. If today helped, hit subscribe and share with a friend.